program or the area agency on aging to try and get some assistance from a counselor. We are independent and unbiased and free of charge. So it's a great opportunity for anybody wanting information about Medicare to get some independent assistance. Unlike brokers and agents, we are not receiving a financial commission from the insurance plan, the drug plans that beneficiaries might enroll into. So in that way, we can stay totally independent. And the State Health Insurance Assistance Program, also known as SHIP, is mandated by CMS, the Centers for Medicare and Medicaid Services, to provide this independent assistance. So let's go ahead and start the presentation. You have a chat box, and so any questions that you may have during the course of the presentation, please type out the question in the chat box, and I'll respond to it as you type it or soon thereafter. I always do start with a little bit of humor, because if any Medicare beneficiaries frequently feel like they're trapped inside the giant maze of Medicare. And so that's a good indication that the beneficiary is probably normal if they feel that way. So that's just a little bit of humor to start us off with. Now we're going to okay, so now let's begin on Medicare eligibility, and let's just consider the first issue of who is eligible for Medicare. There's 3 criteria. Individuals who are 65 years of age or older are eligible. They do have to be a citizen or a lawfully admitted permanent resident who has resided in the U.S. continuously for 5 years. Individuals who are under 65 who have been determined disabled and have been receiving Social Security Disability Insurance, or SSDI benefits, for 2 years also become Medicare eligible. Individuals who have been diagnosed with end-stage renal disease. There's also another category of ALS victims, so people who have been diagnosed with Lou Gehrig's disease, they can also get Medicare immediately. So statistically, 18% of Medicare beneficiaries are under the age of 65. So there's a healthy portion of the population who are under 65 with Medicare. Having said that, the vast majority are over the age of 65. Here's the alphabet soup of Medicare that many of you have seen before. Part A, Part B, Part C, and Part D. These are the 4 parts of Medicare. A is hospital insurance, and B is outpatient medical insurance. On the red, white, and blue card, it does say medical insurance, and I wish it said outpatient medical insurance, because it would be far more descriptive of what Part B does, as we'll see further along in this presentation. If you ever hear me or anybody else refer to original Medicare, and I will be referring to original Medicare throughout this presentation, I'm only referring to Part A and Part B. And we call it original Medicare. Some people call it traditional Medicare. But that's the part that was initially signed into law by President Johnson in 1965. So Part A and Part B is original Medicare. And the other 2 parts, Part C and Part D, started in 2006 and were signed into law by President Bush. So for the first time in 2006, Medicare beneficiaries had prescription drug benefits, and prior to that, they did not have drug coverage. Of all the parts of Medicare, Part D is the only letter that makes sense, because D is for drugs. The rest of them you just have to memorize as to what they do, but we're going to talk about each of those parts today. Now, the next few slides are going to address the Medicare enrollment periods, and I always feel as though this is the missing piece of the presentations on Medicare, because when somebody wants Medicare, they can't necessarily get it just because they have met one of the eligibility criteria. Instead, they have to be eligible for some particular enrollment period that they can acquire Medicare benefits. So there's 5 different enrollment periods with Medicare. The first is the initial enrollment period. The second is the general enrollment period. Then the third is the open enrollment period that we're about to head into next. There are also a number of special enrollment periods. And finally, there's even a disenrollment period that Medicare offers for Medicare Advantage plans. So let's now, over the next 5 slides, look at those 5 different enrollment periods. I want to make sure everybody understands those. So the initial enrollment period is, as the name suggests, the time in which somebody can sign up for all parts of Medicare when they first become eligible for Medicare, either due to age, turning 65, or because they've been receiving SSDI benefits on disability for 2 years. If somebody is already receiving Social Security benefits, they'll be automatically enrolled into Part A and Part B of Medicare. So for somebody who's chosen to take early retirement, or they're on disability already receiving those benefits, they'll simply receive in the mail their red, white, and blue Medicare card 3 months before the month of their eligibility. If they're not receiving Social Security benefits, then that individual needs to affirmatively enroll into Medicare. They would do this through Social Security, and the easiest way is to sign up at socialsecurity.gov, and you can enroll online. The process takes about 10 to 15 minutes, so it's pretty speedy. Now, some people have been confused because retirement age for Social Security is now beyond the age of 65. My retirement age is 67, but people who are turning 65 or 66 now, their retirement age, their full retirement age, is 66. So despite the fact that the retirement age has now gone beyond the age of 65, Medicare eligibility still begins at age 65. The initial enrollment period spans a 7-month window, and it is the 3 months before the month of eligibility, then the month of eligibility, and the 3 months after the month of eligibility. We would always recommend that people sign up for their Medicare benefits in the first 3 months of eligibility. That way, all of their health insurance benefits will begin the very first month that they could possibly be eligible for benefits. So the general enrollment period is the enrollment period that I hope nobody ever has to use, because it is the period that allows Medicare beneficiaries to sign up for Part A and Part B if they didn't sign up in the initial enrollment period when they should have. One of the most common examples that I'm getting of this right now is that 66-year-old who's calling me in the office and asking me when they can sign up for Medicare, where they go sign up for Medicare, and I get to be the lucky guy to inform them that they missed their initial enrollment period window at age 65, and it isn't tied to when they retire. So a general enrollment would occur, the general enrollment period occurs every year between January 1st and March 31st. And it's that 3-month time period. When somebody signs up for Part A and Part B in those 3 months, their coverage does not begin immediately, but rather they have to wait until July 1st before their Medicare benefits begin. And perhaps most importantly, once their Medicare benefits begin, there will be a Part B late enrollment penalty of 10% of the premium for every year that they didn't sign up. I always tell a story with respect to this because I usually get a call in April of a beneficiary who never signed up for Medicare. Perhaps they were healthy at age 65 and they never signed up. Now they're 68 and they've just been diagnosed with something bad, let's just call it cancer, and now they want Medicare. So they called me up with the very basic question of, gee, where do I go sign up for Medicare? And I let them know that they do that at Social Security, but more importantly, I let them know that they can't do it until next January. So they may have to wait a year before they sign up. Then they're going to have to wait until July 1st before their benefits begin. So potentially that person's going to have to wait 15 months before he or she can have Medicare benefits. And they're going to pay that 10% late enrollment penalty on their Part B premium every month for the rest of their life. So that's probably enough of an incentive to get people to sign up in the initial enrollment period when they're first eligible. Now let's talk about the open enrollment period. This is the time frame that we're coming up to now. This occurs every year between October 15th and December 7th. And this is the time period, the enrollment period in Medicare, where there's most activity, where beneficiaries are receiving many, many pieces of information in the mail, where they're marketed to heavily, where you see television commercials advertising one Advantage plan or one drug plan. I think one of the most important things to note about the enrollment period is that this allows changes or enrollments into parts C and D of Medicare. So people can enroll into an Advantage plan or they can enroll into a drug plan, but that's it. That's all that is allowed during the open enrollment period. The name suggests that you can do anything you want to in Medicare benefits, but that's not the case. You really have to wait until other enrollment periods in order to sign up. So I'm going to try and find out what questions we have here, but I can't seem to get to the box. So, oh, here it is. So let's see what questions we have here. Oh, I see. It's Rachel reminding everybody that they can submit questions. So great. Please do if you have any questions along the way. So the open enrollment period, again, spans between October 15th and December 7th. The new coverage begins on January 1st. I think it is important to point out that if somebody signs up for a new drug plan or a new Advantage plan during the open enrollment period, again, the new coverage doesn't begin until January 1st of next year. So the worst thing somebody could do is to disenroll in their old plan, thinking that they've just signed up for the new plan. I see that there is a question right now that says that they were given Medicare Part A only because you have insurance at work. Do I need to enroll in B or D? Gosh, they've just helped me with my next topic, which now I have to try and get back to. Okay, so let me address that with the next slide, which is about special enrollment periods. And I'll come back to that question in a second. So there are special enrollment periods with Medicare, and these are three of the most common examples of those special enrollment periods. This is not the entire list, but these are the three most common ones. And the second one, I'm going to wind up addressing the question that was just posted. But the first special enrollment period is for extra help recipients. And we'll be addressing the extra help benefit later on in this presentation. But it's a program for limited income Medicare beneficiaries who can save money on their Part D drug costs. And for those individuals, they have a continuous or an ongoing special enrollment period that they can switch their drug plan or their Advantage plan whenever they want throughout the year. So that's the most commonly used special enrollment period. The second one, which is going to address the question that was posted, is for beneficiaries whose coverage changes. And the most common one is the loss of employer coverage. So when somebody is still working beyond the age of 65, one of the most common suggestions that is given is that, well, sign up for Medicare Part A only, and then when that person retires, they'll be able to sign up for all parts of Medicare without any late enrollment penalty whatsoever. And that is contingent upon that individual still being covered by group health insurance through their employer. So as long as the over 65-year-old still has employer group health insurance, then they will not be penalized when they sign up for Medicare when they do ultimately retire and lose their group health insurance. On that point, I do want to say that I still think it's really important that somebody who is approaching 65 contact their local SHIP office to ask questions about whether they should be signing up for Medicare and which parts of Medicare they should be signing up for. Group health insurance through employers these days are all over the board. So sometimes people have a high deductible plan that really they can get better coverage through Medicare, and sometimes it would even be more affordable coverage through Medicare if they were to go that route. So it's nice to have the conversation to see if that would be a favorable insurance for the individual instead of their group health insurance. And then secondly, some people have a health savings account through their employer that they like, and they like their plan, and they like being able to use their health savings account. The truth is, if you sign up for Medicare Part A, they can no longer contribute to that health savings account. So there's a lot of nuance to this issue when somebody is working beyond the age of 65, and we just want people to contact the SHIP programs to see what's the right decision for them. The other two reasons why somebody might have a special enrollment period due to coverage changing is loss of retirement insurance and plan termination. So loss of retirement insurance is happening a lot these days, where an employer is terminating the retirement insurance that was previously offered to retirees. And so when that happens, they have Medicare beneficiaries will have a special enrollment period to replace that insurance with other parts or other types of insurance that could cover them as a secondary coverage. And then finally, plan termination. Every year there's plans that terminate their coverages, and so when that happens, they can always sign up for a new plan and still be covered. I want to go to the question. Now I've lost the little window where I can get a question. So anyway, so I'm going to come back to a question in a second, but the third special enrollment period that's most common is when beneficiaries move from one place to another. So when they move, they may be covered by a drug plan that works in the state in which they reside, but at the same time, if they move to a different state, then they may need to switch to a plan that works in the new state. Okay, and then the last enrollment period that I want to address is the Medicare Advantage Plan disenrollment period. And that occurs every year between January 1st and Valentine's Day, February 14th. And this allows for the disenrollment in an Advantage plan. So, and then the beneficiary can opt for original Medicare and a standalone prescription drug plan. This is the newest enrollment period that Medicare instituted, and the reason they did so is that all of the Advantage, I should say most of the Advantage plans are HMOs, and often somebody switches their HMO during the open enrollment period into one that their doctor does not accept. So they might discover in January when they're going to their doctor that they don't accept the HMO that they've just switched into. And this particular disenrollment period allows for the beneficiary to get out of that particular plan and go back to original Medicare with a standalone prescription drug plan. Unfortunately, they cannot switch from one Advantage plan to a different Advantage plan. So they can only go back to original Medicare and a standalone prescription drug plan. So that's the information on the different enrollment periods. I'm going to go back to my questions that have been posted. Bear with me for 1 second while we get back to that. Okay, so here's the question. The question is, where do you find out if it would be better to cancel my work insurance? Is it Social Security? No, I would suggest contacting your SHIP counselor. There is a state health insurance assistance program throughout the United States, wherever a beneficiary resides. So there's always an option for people to get that information from their local state health insurance assistance program. In Arizona, all of these programs are housed at the area agencies on aging. So you can contact your local area agency on aging and ask for the SHIP program, and they can give you the information about switching or not switching from your group health insurance through your employer. Now, when people are on Medicare already, it's important to point out that there's multiple ways that people can get their benefits, multiple ways in which people can acquire their Medicare benefits. And this is important because really Medicare is not Medicare. So people are having their Medicare benefits differently, and what they pay for those benefits are going to be different, and what kind of coverages they're going to have is going to be different also. So now let's talk about the different ways in which people get their Medicare coverages. The first way is basically what I call basic Medicare. They have original Medicare, Part A and Part B, and they have a prescription drug plan. And they have hospitalization, and they have outpatient medical coverage, and they also have prescription drug coverage. However, they are going to have some high copays associated with that basic Medicare coverage. About 15%, 15% of Medicare beneficiaries have that basic original Medicare enrollment. The second way, which is very common, and about 30% collectively have this type of enrollment, have original Medicare along with some secondary insurance, some other type of insurance that pays after Medicare pays. So the secondary insurance is usually either a Medigap policy, also called a Medicare Supplement insurance, or it's a retirement policy. And when somebody has that type of secondary insurance, they might be paying zero for their benefits because Medicare is going to pay first and that secondary insurance is going to pay second. Depending on the type of insurance, if it's a Medigap insurance, they will need to also enroll into a Part D prescription drug plan. So because Medigap insurances don't include drug coverage, the individual will have to have a Part D plan as well. If it's a retirement insurance, that will include drug coverage, and it won't be necessary for them to sign up for a prescription drug plan. The third way that people can get their Medicare coverages, and in Maricopa County, 40% of individuals are getting their Medicare through a Medicare Advantage plan. So these plans have become very popular. Nationwide, about 35% of Medicare beneficiaries get their benefits through an Advantage plan, which is Part C. And we're going to talk more about the Advantage plans later and how they work. But it's a completely different set of copays and deductibles and coverage options. And as I said previously, most of the Advantage plans are HMOs. This next slide is probably one of my favorite slides that Medicare Publications offers, which is a graphic that shows a flow chart of the two different routes that Medicare beneficiaries can go to get their benefits. So the first route on the left is original Medicare, which is Part A, Part B, and Part D drug coverage. And then optional is the Medicare Supplement insurance, also called Medigap. On the right-hand column are the Medicare Advantage plans, which are either HMOs or PPOs, but again, majority of the time they're HMOs, and those plans include prescription drug benefits, so somebody doesn't have to separately sign up for a Part D plan. Okay, now that we've identified the different types of enrollments that somebody can have, let's now start talking about money. And let's talk about the costs associated with Medicare. This current slide shows the cost for Part A of Medicare in 2015. Currently, we do not have yet the 2016 amounts. So I'm going to tell you what it costs this year, and you can assume that next year it will be a tiny bit higher. First of all, Part A is premium free for the vast majority of beneficiaries. As long as somebody has worked in the U.S. and paid into the Social Security system, had FICA withholdings for 10 years, they will be insured for premium-free Part A. If someone hasn't paid into that, then they may have a very hefty premium for Part A. This year, the Part A premium is $407 per month. If someone has Part A and it's just the basic Medicare Part A, their hospital deductible will be $1,260, and after that, there's no co-payments for the first 60 days. It should be pointed out, however, that the Part A benefits only cover the cost of hospitalization, so they don't cover the cost of the doctors coming in to treat the patient during the hospitalization. That's Part B. Part A also covers home health care, hospice care, and skilled nursing facility care. You see the skilled nursing facility benefits in 2015 on the screen. Days 1 through 20, there is no copayment whatsoever. After that, days 21 through 100, the copayment is $157.50 per day, and then after day 100, there's no coverage. So if someone were to have that basic Medicare coverage with just Part A and no secondary insurance, that would be the copays that they would be subject to. As we get to the Advantage plans, the copays are completely different. So again, this only applies with original Medicare. Here's the Part B screen that talks about the costs associated with Part B. This year, the standard premium for Part B is $104.90, $104.90. Higher earning beneficiaries pay a higher Part B premium. So single persons who are earning more than or have income more than $85,000 a year, and couples who have income more than $170,000 a year pay higher means-tested premiums for their Part B benefits. In 2015, the Part B deductible is $147, and that's an annual deductible. Then after that, there's a 20% coinsurance for Part B services. So if I were signing up for Medicare today, or if I were turning 65 today and signing up for Medicare, is probably that 20% coinsurance that would be the most frightening to me in terms of costs. And that's what I would be most concerned about in terms of my healthcare costs going sky high. There is no limit on the 20% over the course of the year, so it can go as high as your imaginations can take you. Part B covers doctor's visits, emergency room treatment, outpatient surgery, mental health treatment, preventive services, diagnostic tests like labs or x-rays or MRIs, outpatient therapies like occupational therapy or physical therapy, as well as DME or durable medical equipment. Before I leave this slide, I just want to touch on the Part B premium. All Medicare beneficiaries right now are sort of sitting on the edge of their seat waiting for what the Part B premium next year is going to be. We don't know yet. That will probably be announced in either late October or November, and then we'll know what it is going to be next year. There may or may not be a cost of living adjustment for Social Security recipients. And if there is not a cost of living adjustment because inflation has been kept down this year, then there cannot be a Part B premium increase for current beneficiaries. So if someone's on Social Security and Medicare and they're paying $104.90, then if there's no cost of living adjustment, then their Part B premium next year will remain $104.90. Unfortunately, Medicare beneficiaries who become eligible next year will be paying higher premiums for Part B because they started in a year in 2016. So we have to wait and see until we know what next year's premiums are going to be. Now, I want to address Medigap insurances, also called supplement insurances. So this is one of the main types of secondary coverages that Medicare beneficiaries have the option of purchasing. This is not mandatory, but about 20% of all Medicare beneficiaries have chosen to have a Medigap policy that pays after Medicare. So I wanted the next 3 slides explain how those Medigap insurances work. They are private insurance policies that are sold by private insurance companies. And as the name suggests, they fill in the gaps of original Medicare. These are all standardized plans. So these standardized plans are all labeled with a letter of the alphabet. We're going to look at those next. And they offer a standard set of benefits. So for example, every Plan F is like every other Plan F. They're all identical. Where they're not identical is in the premium. The monthly premiums can vary considerably. So from company to company, and there's lots of other rules associated with what the premiums may be. There's annual premium increases, but the premiums vary anywhere from $100 a month to $300 a month. So these plans are not necessarily inexpensive, but rather for somebody who can afford them, they'll pay those monthly premiums and they'll have really excellent secondary coverage on their Medicare benefits. There's also a concept known as guaranteed issue, and a beneficiary who is signing up for a Medigap policy has guaranteed issue during the initial enrollment period, but that's a different enrollment period than the one we talked about previously. So we're going to talk about that in a couple screens ahead. So we'll come back to the concept of guaranteed issue. First, I want to look at the different types of Medigap plans, and this is a very jumbled chart, but this is a standard chart that anyone will see when they're trying to diagnose the different options that they have for Medigap insurances. And you see on the top-hand column the different types of policies, all labeled with a letter of the alphabet. Plan F is the most popular Medigap policy because, as you can see, there's a check mark on every single possible thing that a supplement insurance could possibly pay for. So the supplement insurances cover the secondary costs of Medicare Part A and Part B. They do not supplement the costs of drugs. So the supplement insurances only pay secondarily on Medicare Part A and Medicare Part B costs. So there's when someone has a Plan F supplement, which is sort of the Cadillac of supplement insurances, then they know that any hospitalizations that they have that are Medicare covered hospitalizations will not have any copays for them whatsoever. They also know that if they have any outpatient treatment at doctors or outpatient surgery or needing durable medical equipment, they will not have any copays for that treatment as well. There's a question if this chart is available in print form. Yes, it is. It's available in lots of different ways. If you contact your local SHIP program, they can mail you a copy of this. You can also download it from the Arizona Department of Insurance and their Medigap Premium Comparison Book. And it's also in many, many other Medicare publications. It's also in the Medicare and You Handbook, which has been sent to every single Medicare beneficiary across America. So this chart is sort of a standardized chart and is pretty much everywhere in print form. Now, I want to address the eligibility and enrollment into a Medigap policy, and arguably the information on this slide is the most important of all of them. So in order to be eligible to even have a Medigap policy, the beneficiary must be enrolled in Medicare Part B, and they have to be over the age of 65, at least in Arizona. So in Arizona, there are none of these policies that are sold to under 65-year-old disabled beneficiaries. Other states have passed legislation that mandate that these policies, or some of the policies, are also sold to under 65-year-olds, but Arizona is not one of those states. So under 65-year-old beneficiaries, generally speaking, will be shopping for a Medicare Advantage plan until they turn 65, and at that point, they have the option of considering a Medigap policy. The initial enrollment period for a Medigap policy is the first 6 months after somebody has enrolled in Medicare Part B, and they're over the age of 65. So in that first 6-month period, the enrollment has what is called guaranteed issue for the applicant. And that means, guaranteed issue that is, that there will be no medical underwriting for the applicant. So somebody who has a pre-existing condition will not be rejected if they apply with guaranteed issue, nor can the insurance company increase the premium on them because of their pre-existing condition. Everyone's treated the same if they are accepted for this insurance during the guaranteed issue period. If somebody is applying for a Medigap policy beyond the guaranteed issue period, beyond their initial enrollment period, they can do that, and they may very well get the policy. But their ability to get one of these Medigap policies is dependent upon the quality of their health if they are applying after the initial enrollment period. So, when somebody's turning 65 and they're considering how to enroll into Medicare, whether they want original Medicare, do they want a supplement insurance, do they want a Medicare Advantage plan, there needs to be a conversation with the beneficiary to figure out what type of enrollment they want. And many healthy 65-year-olds will choose to purchase a Medigap policy at age 65 when they sign up for Medicare because they know they're healthy then, and they know that they're in their guaranteed issue period when they can get one of these policies without any questions asked. And they also know that if they wait until age 70 or 75 until they're diagnosed with something bad, then they may not be able to get one of these policies. So sometimes determining how to enroll in Medicare at age 65 requires that you have that crystal ball, and you can look into the future and figure things out. Unfortunately, as we all know, there is no such thing as a crystal ball, so we have to just enroll into the policies that make sense for us given our medical conditions. But the Medigap policies are wonderful, and for beneficiaries who have original Medicare and a Medigap, they're pretty darn happy because they know that they won't have any costs, any copays for their hospitalization or their outpatient medical treatment. Now let's discuss Medicare Advantage plans. This is Part C of Medicare, and when somebody has Medicare Advantage, Part C, it incorporates all of the benefits of Part A, Part B, and Part D into one health insurance plan. There's different types of Advantage plans. As this screen indicates, there's HMOs, there's PPOs, there's special needs plans, and there's private fee-for-service plans. So this is already taking us down a path of Medicare getting sort of complicated because everywhere we turn, there's lots of different options of different plans for people to select from. This year, there's about 35 of these plans in Maricopa County. Some counties in Arizona don't have more than 3 or 4 of these types of plans. So it really does depend on where you reside as to the numbers of different plans that might be available to somebody. Again, as I've said previously, most beneficiaries will be considering an HMO if they're considering an Advantage plan, because that's where the significant cost savings will be. And most people wind up looking at one of the Advantage plans because they simply cannot afford the $100 or $200 per month for a supplement insurance. People also like the simplicity of Advantage plans because you're getting all of your covered services through the plan, so you have one health insurance coverage. But there's going to be copays for just about every single service that you could use. So if you go to the doctor, there might be a copay. If you go to the hospital, there will be a copay. If you need durable medical equipment, there will be a copay. If you need outpatient surgery, there will be a copay. Thankfully, most of the HMOs are offered with a 0 monthly premium. So the beneficiary can have this coverage without any additional premium. They do have to still pay the $104.90 Part B premium that again is automatically deducted from their Social Security check. Most of these plans, in fact all of the plans, have maximum out-of-pocket limits, and this is a good thing. This is a catastrophic protection for all Medicare Advantage plan enrollees that basically limits the amount of copays that they would have to pay if in fact something, if they were to be using their benefits too much. So the maximum out of pocket this year is $6,700. So if somebody had reached that maximum out of pocket on utilizing their plan over the course of the year, then they wouldn't have to pay anymore. There is no such maximum out of pocket amount for original Medicare benefits. Some of the plans offer extra benefits like dental or vision or hearing, even transportation, or even gym memberships like silver sneakers. And so a lot of people really like these plans because of those extra benefits that they get. And many of them, if not most of them, include prescription drug coverage. I want to look at some of the non-renewing plans, and this just applies in Maricopa County. So these are the plans that are not renewing for 2016. Scan Health Plan, as well as all of the CareMore plans. CareMore offered a number of different plans in 2015, but these plans are not continuing for 2016. So for the 15,000 individuals who were enrolled in one of these two company plans, they will have to make new choices for 2016 because these plans will not be available to them next year. Non-renewing plan member options, there are two options for these members who have these plans. One of them is kind of a good one, but the first option is simply to select a different Advantage plan. And that will be the option that most people will select. They had an Advantage plan before, and they will choose to have a different Advantage plan because their plan is going away. Most of them will select during the open enrollment period, and that way their new plan will begin on January 1st of next year. But there is a special enrollment period because their plan terminated, and they really can pick a new plan as late as February 28th if they were enrolled in one of those plans that discontinued. And then also another interesting aspect of their special enrollment is that since their plan discontinued, they are afforded a special guaranteed issue window to purchase a Medigap policy until the end of February. So it's a 2-month guaranteed issue option to purchase a Medigap policy if they wanted to go from the Advantage plan option for Medicare to original Medicare with a supplement insurance. So that can be a good option for people who wanted to switch back to original Medicare. In 2016, in Maricopa County, there are some new Advantage plans. United Healthcare is going to be offering a second Advantage plan. It's called AARP Medicare Complete Plan 2. They still have their original plan as well, so there will be two choices for beneficiaries. And then most interesting, Fresenius is a new player in the Advantage plan market here in Maricopa County, and they will be offering a special needs plan for persons who are diagnosed with end-stage renal disease. That's important because people who are diagnosed with ESRD are not otherwise permitted to enroll into an Advantage plan. It's when it's the only exception that where somebody with that particular pre-existing condition cannot have an Advantage or cannot enroll into an Advantage plan. But next year there will be a special needs plan specifically designed for people who have been diagnosed with ESRD. Okay, now let's look at the Part D coverages. First, I just want to point out that people can get Part D benefits either through a standalone Part D plan or as part of a Medicare Advantage plan. One way or the other, it's Part D. Now, this next slide is perhaps the most confusing slide of the whole presentation, but let me characterize Medicare Part D benefits in the following way. They're unlike any prescription drug plan ever invented, because Medicare beneficiaries who have Part D coverage may have different coverage periods during the course of the year where they're paying different copays for the same medications at different times of the year depending on which coverage period they're in. So the average premium for a standalone Part D plan next year is $34.10. Some plans have a deductible and some plans don't. Next year, the maximum deductible that plans could have is $360. Then there's the initial coverage period where the beneficiary would pay 25% of drug costs. And that coverage period goes up to $3,310 in total drug costs. That total drug cost amount is both what the member is paying as well as what the Medicare plan is paying. Once the person reaches $3,310 in total drug costs, then they enter the donut hole, also called the coverage gap. And in the donut hole, the beneficiary unfortunately pays more for medications. So next year they'll be paying 45% for brand name drugs and 58% for generic drugs. And then if they make it out of the donut hole after $7,062.50 in total drug costs, they'll have catastrophic coverage where they only pay 5% for drug costs. So Medicare beneficiaries can have sort of a roller coaster of costs during the year. I want to say this, and this is very important. There's only one way for Medicare beneficiaries to truly cost out to the penny what their drug costs will be for 2016, and that is to do a Medicare.gov plan finder online at Medicare.gov and put in all of their prescription drugs and see what the cost options will be for the next plan year. They can also come to their local SHIP program, and their local SHIP program can assist them in finding out which drug plans will be most favorable for them. So I very much encourage people to take advantage of the SHIP programs and the assistance that they can provide. A couple plans that are not renewing, one plan that is not renewing in Arizona next year is the Smart DRX drug plan. It was offered this year, but it won't be continuing next year. And then there's also a new Part D plan offered by Magellan. Some of you remember that name as the previous Regional Behavioral Health Authority, at least in Maricopa County, and now they're in the Medicare Part D market offering a prescription drug plan. So that covers the different parts of Medicare, Part A, Part B, Part C, and Part D. And before we finish, I very much want to cover some of the limited income benefits that are afforded to Medicare beneficiaries. So there's two different programs that can help save Medicare beneficiaries money on their coverages. One is called the Prescription Drug Extra Help Program, and the other one is called the Medicare Savings Program. And so I want to talk about each of those programs in greater detail and cover them each separately. So the first is Extra Help, and when someone is getting the Extra Help program, it's going to lower their costs for prescription drugs. And you see on the screen the monthly income limits for a single person or a married couple, and this program also has a resource test or an asset test where they're going to look at their savings accounts or their annuities or any other kinds of assets that the person might have. There are some assets that are not counted in this particular program, and those are the house that the beneficiary lives in, the car that they drive, and any life insurance policies with their name on it. But any other asset, 401k, savings accounts, cash, will be counted towards the resource limit. Here's some Extra Help co-payments in 2015. Actually, in these, I apologize, these are for 2016. I need to update the title on this slide. So in 2016, these are the Extra Help co-payments if somebody is receiving this benefit. If somebody is on Altex, the Arizona Long-Term Care System, and they have Medicare Part D, their drug costs are zero. So that's a really fantastic limited income benefit for Altex recipients. There's also three other categories of Extra Help. One is up to 100% of the federal poverty level, and those individuals would pay either $1.20 for generic drugs or $3.60 for brand name drugs, and those copays would be for the entire year. So those beneficiaries would not have any kind of donut hole issue that they have to deal with. There's also another category called full extra help with $295 or $740 pricing on prescription drugs. And then there's also a partial extra help category that's a little bit more complicated to explain. But nevertheless, if somebody is underneath these limits, then they should be applying for the extra help program. The SHIP programs can also help current Medicare beneficiaries determine whether they're eligible for extra help and also help them apply. Here's the information on the Medicare Savings Program. This particular program is really vitally important to many Medicare beneficiaries. Some of you have heard these acronyms before, QMB, SLMB, or QI1, more affectionately called QMB and SLMB and QI1. But this program can pay for the Medicare Part A and Part B premiums for individuals. So that $104.90 Part B premium can be paid for by the state of Arizona through this access program, Medicare Savings Program, if somebody is eligible. You see the two upper income categories for this. For a single person, if their income is less than $1,345, they're eligible. Or if it's a couple and their joint income is less than $1,813, they're eligible for one of these programs. Now, I want to point out that the Medicare Savings Program does not have an asset test. So there is no consideration of a person's assets or resources when considering eligibility for this program. Access only looks at their current monthly income to determine eligibility. So that's a very, very important distinction for this particular benefit for people applying. So even if someone has $900 a month in Social Security benefits, but they have $100,000 in savings, they would still be eligible for one of these Medicare savings programs. Now, let's go ahead and talk about one final issue, and that is fraud and abuse. It's really important that all Medicare beneficiaries appreciate and understand that fraud and abuse is a huge problem with Medicare. It's estimated that $50 billion every year is inappropriately paid out by Medicare as a result of either fraud, errors, or abuse. CMS and the government is trying to do everything they can to try and detect these fraudulent payments as soon as possible so that they can stop them. I want to go back and I want to address a question that's been posted before I go to the last couple of slides. And the question is that if the individual has insurance through their work and they only have Medicare Part A, should they contact SHIP to see if they would be wiser to let go of my insurance at work? Look, I think it's always a smart idea to compare your options. It's always a smart idea to evaluate whether it would be smart to sign up for other insurance. As we talked about, there's enrollment periods for Medicare too. So it's important to consider if you're going to have a special enrollment period, which you probably will if you're terminating your group health insurance to sign up for Medicare. So it's always smart to compare whether you can save money and still maintain appropriate health care coverage as compared to your current coverage. Here's the last slide on preventing fraud and abuse. We want individuals who are on Medicare to review their Medicare summary notice or their explanation of benefits so that they can see if there's any inappropriate charges on these statements that are sent to Medicare beneficiaries. It's important that they protect their Medicare number. Only give out their Medicare number to persons who would need it, like their doctor's offices or other trusted individuals. There are times that there are phone scams where people call Medicare beneficiaries and try and take advantage of them to get their Medicare claim number, which, as many people know, is usually their Social Security number. If somebody thinks that they've been a victim of identity theft or a victim of fraud or abuse, I want them to call the Senior Medicare Patrol Office at this area agency on aging at 602-241-5569. And finally, here are the resources for assistance. Let me just briefly talk about these. Medicare.gov is a wonderful, wonderful website, has really awesome information on it to help Medicare beneficiaries figure out what's covered by Medicare, figure out what they should enroll in, and also select prescription drug plans or advantage plans that will cover all of their drugs. 1-800-MEDICARE is the telephone community information line for Medicare beneficiaries. It's important that you know that it's open 24 hours a day, 7 days a week. So 1-800-MEDICARE is really super in terms of providing information. They can enroll people into plans and also provide some telephonic information. Individuals who are enrolled in their prescription drug plan or their Medicare Advantage plan can call those plans directly, or if they're interested in enrolling in those plans, they can call them directly. And of course, they can contact in Maricopa County the State Health Insurance Assistance Program at 602-264-4357. That's the Area Agency on Aging's Senior Helpline, which is also a 24-hour-a-day, 7-day-a-week community information and referral line operated by the Area Agency on Aging here in Maricopa County. And as I indicated, that there are area agencies on aging around the state or across the nation for that matter that can provide information to Medicare beneficiaries, helping them sort things out. So I'm glad that all of you attended this presentation. I'm glad that I was able to be here. Thank you to MAG for hosting these presentations. I know that there's one final question or comment being typed right now. So you're welcome for this presentation. Thank you for participating. If there are any final questions, I think we have like maybe 1 minute left. So anyone who has a final question is welcome to type it on. I'm happy to address it. Back to slide 15. Well, let's go back to slide 15 very quickly and address a question or just cover it one more time. Here's slide 15, which is the original Medicare Part A amounts. Nelma, is that the slide that you were interested in seeing? The contact for SHIP. The phone numbers for SHIP is going to be the area agencies on aging, and in Maricopa County, you would contact through the senior helpline, which is 602-264-4357. That's on the very final slide, 602-264-4357. You can also visit our website at aaaphx.org. Once again, that's aaaphx.org. We have reached our end of the webinar. I very much want to thank each and every one of you for participating. If I can be of further